Hi, my name is Brett Cunningham, owner of Physio and Ross in Townsville. Often we'll get asked, what sort of physiotherapy skills do you use? Well, depending on where you're trained, they'll be wide and varied, but generally in physio, we will do a lot of hands-on. We do a thing called joint mobilization. So, for example, around the neck, I will go along with my fingers and feel the individual vertebra and look for any signs of stiffness. If it is stiff, I will then sort of mobilize to try and get some movement back. It is not to be painful, but if it is blocked and it's been chronically there for years, you may find some discomfort, but once we loosen it off, hopefully your symptoms will improve. We also do a lot of massage. Now, there's different types. Now, if an ankle is swollen with an acute sprain, we'll do a slow sort of pressure around it going from distal to proximal. That's called effleurage, just to try and get some of that swelling and circulatory improvements. But later on, with a lot of my treatments of necks and backs, I'll do a lot of hands-on with a sort of a connective tissue massage or a remedial massage, which is fairly firm. And in our sedentary life, often muscles are tight and we need to get in there and try and iron them out and loosen them. Now, again, it's not to bring tears to your eye, but if you are tight, you will feel that that's probably a little bit uncomfortable. But once we loosen it off, again, and stop those muscles pulling on the two connections, the origin and the insertion, you will get relief. We also do taping. I do dry needling. I've done it the last 10 years. It's not something you'll learn or taught in undergraduate. It's a postgraduate thing. It's not for everyone. It's not my first choice of technique, but it's just another adjunct. As you develop, as you get more experience, you need other feathers in your cap to try and help people who have plateaued. I do it to try and get a healing response by getting an isolated circulatory response into a specific area. We also do traction. I'm a bit old school. I don't do it much now, not half as much as we used to do it. I've done this for 35 years. It's mainly for necks and lower backs. We slip a harness around and just give a light controlled stretch. It is not to hurt you, but it's something we used to do a lot more in the past. One of the reasons for this is possibly just generalized degeneration, because anytime we're upright, we've got gravity compressing. So it is nice to give a light tractional force, but we're very exercise driven. So we will find weaknesses in your body, and if we can get that stronger and give you some better muscular support, these exercises are not to irritate. I don't mind them being a little bit of hard work. That's why you're here, but they will gradually be progressed as time goes on. Many years ago, I worked in the hospital, so I've got respiratory skills, so I'm quite happy to see, pneumonias or bronchiectasis. I also worked in many units in Australia and over in London, with neurology or strokes or head injury. So I'm quite happy to see them. This practice, as you can see behind me, is more built for musculoskeletal concerns or private concerns. But we set it up. We make sure we assign a lot of time because they need to be closely supervised. They need to be safe.